having a joint replacement surgery, even though we use minimally invasive techniques these days, there is going to be a period of pain, and that's quite normal. You know, to have pain in your knee or your hip or your shoulder or elbow for even up to 4 to 6 months, I would say is perfectly normal. I would say though, if your pain worsens after a joint replacement, or if your pain is persisting, significant pain beyond 4 to 6 months, you really should have things checked out. And so typically the first step is to see the operative surgeon. They'll typically get x-rays, maybe do a physical exam, try and understand what it is that's causing pain. Sometimes it's as simple as tendonitis, and you know, it may take time, or physical therapy, or anti-inflammatories, or you know, non-surgical methods to heal things up. And thankfully that's the vast majority of people. On occasion though, there's something intrinsically happening with the joint itself. So the joint may be loose. Sometimes we see people with unusual infections. So there are other issues that can cause ongoing pain, and if we see that, then we, depending on what the problem is, we address it appropriately. The joint replacement revisions are really a spectrum. They can be anything from a simple swapping of a single part to changing all the parts. And it really depends on what the problem is. If parts are loosened, for example, usually we have to take those out and replace those. If someone has a single piece like a plastic that needs to be upsized, it's usually pretty easy to get those out and put in a larger size. The majority of revisions that we do tend to remove all the parts and replace it with a different type of a part that's adhered in a different type of a way to help avoid the same problem that happened the first time. But it can be as simple as you know, a small incision with 1 or 2 parts being replaced as well. In cases of infection is a really difficult problem to get under control sometimes, especially with joint replacements. The reason being is that bacteria tend to stick to metal, and so if you have an infection of a joint, typically the bacteria will adhere to the metal parts of the joint, and even despite surgery or sometimes antibiotic therapy over time, they'll remain there and the infection may persist. And so in cases like that, it's more of a major revision where we have to remove all the components, treat the infection, and then put the components back in over time to ensure that the infection doesn't come back. The vast majority of patients that we see with painful joint replacements, we can identify what the issue is and we can fix it. It may not be easy. It may involve surgery or weeks or months of physical therapy or even medications at times. But I would say in the majority of folks that have painful joint replacements, we can find them a diagnosis, try and help them understand why the joint is painful, and also offer them a solution. So there is hope.